I would say the national average is the amount of time that a doctor spends with the patient is about 8 to 10 minutes, right? There's no healing that can happen in 8 to 10 minutes. There's no counseling that can happen in 8 to 10 minutes. There's no cure that can happen in 8 to 10 minutes. There's no prevention that can happen in 8 to 10 minutes. Prevention takes time. Counseling takes time. Being a partner in one's health takes time. Answering questions takes time. And if you don't have time for your patients, what ends up happening is that you're either referring, you're either prescribing, or you're ordering unnecessary tests and just bringing, patients back, again and again for these, tests and revisits and follow-up visits, and little gets done in those 8 to 10 minutes. That's what a conventional regular visit looks like. When patients come to us, right, one of the things that we want to focus on is, number one, risk stratification. Like, where do they lie on, a risk scale? Like, how is their lifestyle and their genetics and all these things, how do we have to first risk stratify them, right? And in that, we do a certain number of tests that are a little bit more comprehensive, or I should say a lot more comprehensive than you would generally find at your, regular run-of-the-mill conventional doctor's office. And we do this because, we want to be ahead of that game. We want to be ahead of the people's diseases, right? Because we believe it's easier to prevent than to cure, right? So, for example, the top 3 things that I would mention is, number 1 is a comprehensive blood work, right? And it's more than a blood work, but it's a comprehensive biomarker analysis where we take a look at your overall vitamin D levels, vitamin B12, folic acid. We do advanced cholesterol health. So now that's not just a standard lipid panel, but more along the lines of, like, what is your ApoB level? What are your lipoprotein fractionation look like? So really get down into the details of your cholesterol health. Then we get into, like, the more hormonal health, like, for example, thyroid hormone health, testosterone, or women's health, like looking at their testosterone. So a very comprehensive look at their, complete biomarker profile, and based off of that, risk stratifying them. That's number 1. Number 2 is what we focus on is their overall physical and what we would call is a biomechanical health. And we do that by getting a DEXA scan. A DEXA scan with a body composition. What that includes is a DEXA scan is usually done for a lot of patients after age 65 to find out their risk of hip fractures. Turns out you can also use a DEXA scan to very accurately measure a person's overall muscle mass, overall bone mass, and overall fat mass. And you can divide that into your visceral fat and subcutaneous fat. Now, we know that visceral fat is the fat that's directly involved in a host of diseases, pretty much most and all chronic diseases, whether that be diabetes, whether that be hypertension, whether that be metabolic syndrome, whether that be hypertriglyceridemia or hyperlipidemia. So we're able to calculate that. And when we are able to present that to people or patients or clients, they're able to look at that, get that information, and able to make measurable changes in their life because they're able to measure something that's directly impacting their health, rather than saying, like, oh, you may have this or may have that, right? So that's number 2. And then focusing on number two, the biggest thing is focusing on their muscle mass. And we do that every year for these patients. And what that does is that it establishes a baseline from year to year that, okay, what we want to see is that we want to see an improvement in their bone mass, and we want to see an improvement in their muscle mass with a simultaneous decrease in their overall fat mass. So people have a goal to work towards. So that's number 2. And lastly, number 3 is it goes hand to hand with number 1 is risk stratification, which we talked about. And we do that with a coronary calcium score, and we do that generally in people that we identify as a little bit higher risk, where we do a coronary calcium score to really look inside their a coronary calcium score is a CT scan of the coronary arteries, where it looks inside the coronaries and it calculates the amount of calcium in it. Now, it correlates with their cardiovascular risk factors. So again, the whole point is to use the tools that are, that we have to really assess a person's overall health and well-being, and really give them the benchmarks, be like, this is where you are, and this is where we want you to be, because we want to prevent, right? We don't want people to be in a position where they're running after their disease. We want people to be preemptively trying to make changes in their lifestyle for better overall health and wellness. That's what we want our patients to be.